We have a very special guest, our next speaker. And one of the things we want to be conscious and thankful for is that, one of the few disciplines out there in medicine that has always taught prevention has been the dentist, right? Brush, floss, and now rinse daily. And went to a conference recently in Nemacolin, and the dentist that's going to speak today was one of the people at our booth. And we had such a tremendous amount of people coming by to visit him because he teaches at Pitt Dental School, and most of the people there actually been his students. So since I guess the mid to late 70s, he's been teaching at Pitt. He's the inventor of the triple tray, which is a dental tray that we've all have used as the dentist at one time or another. It's become the #1 worldwide tray for dentists, and it's actually saved us a lot of pain because the new ones now are painless, but the original ones were a lot of pain. So he's taught at Pitt Dental School. He's a graduate of Temple Dental School. He's the inventor of the triple tray and also the Miracle Mouthwash by Nutritional Frontiers. This guy looks the part. He lives the part. So a nice warm welcome for Dr. Randy Werrin.
Okay, thank you, Jamie.
Thanks, Doc.
When I saw Jamie, I said, Jamie, you're looking good. And I want you to all know there are 3 stages of life. Youth, middle age, you're looking good. We're in the looking good stage. Well, thank you for being here. I'm always amazed when I give these talks how there's always a different crowd out here. So this is good for me because I can give some of the same material again. And we're going to talk about how to keep a beautiful smile, how to keep your teeth. All of you in the audience have teeth or have some teeth, right? But we're going to talk about why they're important. Come on over here. You can hear me better and see stuff. So let's get started. I'm going to start off by showing you my most beautiful patient, beautiful teeth, Miss Pennsylvania. She came in second, then she came to see me, and I whitened her teeth. And then the next year, she won. But beautiful teeth, it's all depending on your culture, what's beautiful. I went to Thailand. I lectured twice in Bangkok. And in the hill country of Thailand, they like to chew betel nut juice. And so their teeth get sort of black, but they think they look good, I think I look good because my hair's not as dark. Now, teeth are really important. When I was in Hong Kong at the zoo, we were looking at the baboons, and the trainer there wanted to show everybody how healthy the animal was. And how did they do that? He had him open his mouth and you looked in his teeth. And doctors do that too. You can tell a lot about how healthy a person is by just looking in their mouth. So if your mouth is healthy, probably the rest of you follows because that's attached to the rest of your body. So this is what a perfectly healthy mouth looks like. And I just saw this lady who's now 45, that she was a teenager then, because you probably never see people with perfect teeth like this. This is what you're supposed to look like. This is what God gave you. And if you take care of it, and your father's a dentist, that helps. Your mouth has no fillings, and everything's in alignment, and you look like that. And if you notice, it's beautiful. God has a way of making form and function work. It's just incredible, And when your teeth aren't meshing right and they're out of whack, you get in trouble. Now, so ideas don't work unless we work. So your brain needs your body to work. This is also very amazing. I put this up only because that's my grandson. And isn't he cute? But isn't it amazing how all these teeth fall out, your baby teeth fall out? Why don't you come over here? You can't see over there. Get over here. Now you can see where we're going. Now you can really see. And I can see you. It's more important. But isn't it amazing how all this stuff goes on? I mean, it's a miracle. That's why I think we call our mouthwash Miracle Mouthwash. This is really a miracle. Now, I'm going to just put these on very briefly because this is the most pleasant thing to look at. But I put perfect teeth. Now I want to put what a cavity looks like. Because I was a freshman at dental school, and I didn't know what a cavity was, really, because I never saw anybody with cavities, even though I had some as a kid. But you can see this brown area right here, something over here. This is where the germs in the person's mouth are eating away at the tooth and it turns brown, decalcifies and turns brown. And then this person had these black fillings put in and some white fillings put in, and not too good. Actually, this is caused by either gum chewing or soda drinking, because they're at the gum line. You notice most of the cavities are at the gum line right here. When you drink a lot of sugary drinks, everything sort of pools right at the gum line, and you get that. All right, we'll turn that off. Oh, whoop. Then we got another one. Another one. This is from soda. I'm not making this stuff up, by the way. I mean, I took these pictures. I think I took that at the dental school. Now, this is hard to believe. This is my daughter when she's little. Now, in nature, about 150 years ago, anything that was sweet that was in nature was good for you. You know, like if you had an orange, which was around 150 years ago, I think, it was nice, it was good. And so your brain said, serotonin, you know, this is good, I want more of that. But about 100 some years ago, somebody figured out, take sugar cane and make sugar out of it. And the sugar cane probably wouldn't be too bad, but when you make it refined, you end up with sugar that's white. And anything white to me is like dead. And it's too processed, it's too strong. And most of the dental problems we have are related to that. I would highly recommend Michael Moss's book, Salt, Sugar, and Fat. It's a book that's only 2 years old. He's a New York Times Pulitzer Prize winner. And the food companies know that if a food wants to be a big seller, all you got to do is put more sugar, salt, or fat in it. Matter of fact, when the fat aspect, you know, was this big thing, let's take out the fat. So how do they make the food taste better? Just raise the sugar and the salt, you know? So you can put sawdust with enough salt, sugar, and fat in it. You probably think, oh, that tastes good. Halloween time is, of course, a tough season for me with my personality. You know, I just don't like kids eating sugar. And, of course, my grandkids, they don't know any better. And so we have that sign there. This is an interesting picture. Anybody recognize Winchester Thurston's school there? I was just working on the guy who runs the place, and I was telling him I'm going to be showing a picture of his school with a Coke truck in the parking lot. And now, this is a very high-class, highly educated group of people, you know? But unfortunately, when the kids get hungry, Coca-Cola has very good salespeople that said, we can make a lot of money for this school that always needs money. And for that matter, Pittsburgh Public Schools is the same way. We'll sell vended food for you, and we'll give you a check every month. Since they need a check every month, they say, sure, that's a great idea. But that's where my daughter went to school, and unfortunately, you know, Coca-Cola is sold in that school. So I went and gave a talk one day to these teenage girls. I took an old tooth that was extracted, put a string on it, put it in a Coke bottle, and it sort of dissolved right there from the phosphoric acid. You know, what is in Coke? Think about it. It's water. That's the good part. It's all the other stuff that's not good. Phosphoric acid. Acid dissolves things, right? And then there's sugar. And probably, if it were that size Coke bottle, we'd be fine. But if you go to Super Size Me McDonald's or someplace and you get a big thing, it can be like 13 tablespoons, 48 grams. By the way, if you want to know how many teaspoons, divide by 3.5. So if it's 48 grams, just divide by 4, or 3. That's a lot. Is there any question why we're the fattest country in the United States? Your body can't handle that much sugar. So it turns it to fat because it's too much. But let's get back to the teeth. So the Coke has the artificial color, it has the sugar, it has the phosphoric acid and all kinds of other stuff. Benzoic acid, another acid to preserve stuff. So all these things dissolve the tooth, and I show the kids. Not that it matters, because on Saturday morning they watch the TV or they get hit by all kinds of Cokes. And I went to the movies the other day, and right in the movies, Coke does this on purpose. They have a guy drinking a Coke, so everybody sees he's drinking a Coke. They hit you all the time. You're hearing me, but I'm a lone wolf. There aren't too many people out there giving these talks like this to try to counteract billions of dollars being thrown at advertising to drink this garbage. But it's not just the United States. They figure, well, let's go to, I travel a lot. You go to other countries. You go to Europe. And this guy who thinks he's so cool, he's drinking a Coca-Cola. And I'm thinking, what a moron. Oh, but that's me. So, breakfast cereal. So I went to a food market near my office to just see what they're selling. Which reminds me, I also went to West Virginia to Lakeview Country Club, and I had to eat breakfast there one morning. And this is what they had for me to eat. I felt like I was in a food desert, I call it. A food desert, because what am I gonna, a guy like me, I'm a health nut. I really like to try to have my body get good stuff in it, But at West Virginia, Lakeview Country Club, which is one of the nicest resorts in West Virginia, it was a food desert for breakfast. I had a choice of Lucky Charms or Honey Smacks or Cocoa Puffs. Cheerios wouldn't be too bad, but Honey Cheerios and Cheerio Cocoa, it's all sugar. And sugar is a big problem, I said, with your teeth. Let me explain why something like this is not good for your mouth. If you have a mouth that has some moisture from saliva and some bacteria in it, which you all do, everybody in this room has this situation, and you put sugar in it, come down, come on, you're paying attention. What do you want to stand there for? Okay, so if you have moisture, warm, dark, and moist, and put sugar in your mouth, then you grow more germs. What causes tooth decay? Germ poop, the waste from the germs. So if you have a lot of germs growing in your mouth because you're putting sugar in it, the acid from the germ poop, it's called lactic acid. You've all heard of lactic acid, right? Dissolves things. If I put lactic acid on your pant leg, what would happen to it?
Dissolve?
Yeah, it would dissolve. You'd have a big hole in it. So if the germ poop is on your tooth, you're going to get a hole in your tooth, right? So now you know when I showed you the decay, what happened to that person. Too much sugar. It's not that the sugar dissolves your teeth. It's not the sugar. It's the sugar is the food for the germs, okay? So that's why I'm spending a lot of time here on food. These are the things, Honey Smacks. You might as well have a candy bar for breakfast. Now, there is one thing you can do that is helpful, and that's xylitol, which is a sugar alcohol. And alcohol is a bigger molecule, meaning the bacteria can't eat it because it's too big. Sugar's only 6 or 5 carbon chains. Sugar alcohols can be, like 90 or something. So Dr. Weiner sells gum over there. Orbit happens to have a little bit of it. You've heard of that. That's a Wrigley product. This is much better. And these kind of xylitol gums, you can get it like Food Co-op or Whole Foods or Trader Joe's or something like that. All right, so what are the goals for good dental health? How do you reach them? 4 things. Good oral hygiene, I'm going to talk about that in a minute. Nutrition and diet, which I've been talking about. You got to come into the dentist twice a year because you can't see your own mouth. I like your body language. Her body language was like this. We are talking about it. And you have such a nice smile, so you don't have to do that. And I know you spend a lot of time at the dentist. I can tell. I know. Self-motivation. Smile, the universal language. I like Ogden Nash said this. Man has to go to the dentist to keep his teeth in good condition so that he won't have to go to the dentist. Ogden Nash. So what do your teeth do? They do a couple things that are really important. You might not think about it. What's the first part of digestion? Chewing your food. Because there's all kinds of enzymes and all kinds of saliva that mesh with your food. That's important. But if you don't chew your food up, you can't get it in your stomach. It doesn't work. So what happens to a cow, a pig, a dog, any other mammal you want, a platypus, what happens to all these things when they lose their teeth? Shortly afterwards, they die. Guess what? We're mammals. You can say, well, we can set a denture in your mouth, upper and lower denture. Matter of fact, I have these people, I don't know what they're thinking. They say, just take my teeth out. I'll get false teeth. When you have false teeth, like there are some people in this room, I'm looking at this guy back here because I can tell he's got some missing back here. When you lose your teeth, you can't chew as well. It hurts. It's miserable. Who wants plastic? George Washington gave the shortest speech of all time, his second inaugural address. It was only like a minute. You know why? His mouth hurt from these stupid dentures that they made out of ivory and walrus or some crazy wood. He couldn't talk. They had springs on him. They're at the Smithsonian Museum. You can see them. That's why his speech was so short, because he was in misery. Poor George, he didn't live 2014 like we do. So he wasn't that old when they said, you know what, George, you got to have all your teeth out. He said, okay. Of course, that wasn't as bad as the other president. They drained his blood and killed him, Garfield, Oh, we got to drain all your blood out and give you mercury. That was good. All right. Keeping him comfortable, that's what I'm talking about. You want your mouth to be comfortable. Trust me, if you have a tooth that has a nerve that's dying, you get a root canal treatment or you get your tooth out when that happens. But if you're not comfortable, there's nothing else you're thinking about except getting comfortable in your mouth. You might not think your teeth are important for speech, but speech is really important. You can't speak if your teeth aren't correct position. You've all heard people lisping when they're some kind of removable appliances in their mouth or spitting on you because their teeth aren't right. But this is the part that is getting a lot of press lately. The main killer of men and women is what disease? Anybody want to guess?
Heart disease.
Heart disease, that's right. It's amazing how many people say cancer. But cancer is so far behind heart, it's not even close. Not even close. It's not even an issue. And there are risk factors for heart disease. 1, high blood pressure. 2, smoking. 3, maybe high cholesterol. Too high, really high. Or stress in your life. Well, these are all risk factors. But get what we feel now that can make you last about 7 years longer, they say. I was watching TV and somebody was mentioning this. And that's having a clean mouth. Why would that be? Because what we were talking about before, if there's a lot of germs in your mouth, if bacteria are jumping all over the place, because it's warm, dark, and moist, and you put sugar in it, germs will be growing all over the place. That's a risk factor for heart disease. So you want to get your teeth clean. Why do you think if you have a transplant, the doctors are so concerned about how clean your mouth is? If you have a heart valve issue, get your teeth clean. Keep your teeth clean. Why? They know that the bacteria can get into your bloodstream through your mouth. All of you have had your gums bleed sometimes when you brush your teeth, I'm sure. And it goes both ways. If the blood goes out, germs can go into your body through your mouth. And of course, improving appearance for a female. This is really important. I have a picture in my office. The only thing that changed is the way this lady looks, teeth-wise. And in the first picture, she has crowded teeth and spaces and really looks bad. No job, no boyfriend, no self-esteem. And in the second picture where we fixed her teeth, she looks like a movie star, all just because of the smile factor. So this is an example of a CMU, time is it? I want to see how I'm doing on time. I'm good. A CMU professor. She was about 50 years old. She finally had to come to see me. She was scared to death. So many people are phobic about going to dentists. You know, they just won't go unless something hurts. I have a guy in Oakland. He just won't go. If something doesn't hurt him, he's not coming in. But she had to go because these teeth were rotting away and this one broke. This is a PhD at Carnegie Mellon, at the Mellon Institute, you know. But we fixed her. And I want to just show you the difference between looking bad and looking good. The same lady. This isn't her, but it's the same idea. What a difference. Her whole life has changed. Psychologically, it's changed. That's why I love my field, because I do a lot of cosmetic work for people, and I can change their life. Anybody want to guess who that is? This was referred to me by a Beverly Hills dentist. He said, this is what happened. I'm on the golf course, my cell phone rings. You got to see this guy. This is a big star. He's entertaining in Pittsburgh that Sunday night and it's Sunday morning. Anybody know who this guy is?
Glenn Camp.
Yes. Yeah. So his Beverly Hills dentist said he's on his goodbye tour. He has Alzheimer's. Yeah. So he comes in with his rockette second wife, who takes care of him. But she's not a rockette anymore, but she's real nice. And I fixed him. But what a difference. He could have performed, I guess, but it's much better the second way. I did that all within about a half an hour. Glenn Campbell. This is what's crazy. Who's Glenn Campbell, girls? Isn't that amazing? The girls in my office didn't know who Glenn Campbell was either. 50 million records, that's all. 50 million records. He's like, yeah. Fortunately, for this crowd, this is good. But for you two, forget it. He's really bad. Rhinestone Cowboy, never heard of that song. You heard of that song? Yeah. Channel on My Mind. You ever heard? Yeah, you heard that? I'm telling you, there's a lot of them out there. A lot of them out there. He's quite a guy. By the way, he thanked me 7 times. I don't think he remembered thanking me once, but I was thrilled. All I care was, can I take your picture and use it in my lecture? He said, sure. Of course. He said, sure, and okay, wouldn't matter. What's important to patients when you go to the dentist? You want to be out of pain, you want to chew better, and you want to look better. We're not going to hurt each other, are we? Yeah. I actually sort of had that almost happen one time. I want to show you a picture of some befores and after, what we can do for people. I mean, this gal looks fine, but we whitened her teeth. This is bonding. You see how crooked? I've done this for a lot of people, and it's pretty easy sometimes when you do it. Now watch. What a difference, huh? Just the teeth. Well, and the hair. This is what a cavity looks. If you go to Europe sometimes, you'll see this. People walking around there. I can't believe it. In third world countries, they walk around like this. So we can fix it. And spaces between the teeth, we can close those with bonding. We do it with composite resin. I won't go into that too much. Broken tooth, composite resin, we can fix it. I did a guy named Tom Hulse. He was in Mozart, Amadeus, the movie, you know. But then he came to Pittsburgh and he did a movie called Dominic and Eugene, and he had to look like a sort of a derelict. So we can go either way, good or bad. So we made him look bad. We put this thing on and we made some cavities there. And this, again, this is Pittsburgh Symphony conductor's wife. And we made her look pretty. This is a good story. This girl comes to the dental school, and her boyfriend's always sitting there. He's sort of what I would call a nudnik, for those of you who know Yiddish. And we bonded her teeth, and you can see the big improvement. And guess what she did with the boyfriend after she got her teeth fixed? Dum-dum. Right. Laura Hutton, again, another old-time person. But she walked around, she thought that was pretty, and when she had her modeling pictures, she had a little thing that she put in there. So, you know, you can see there and there. Now let's talk about mercury fillings, because a lot of you that are listening to me have mercury fillings. Is mercury safe?
No.
On the periodic table, there's a material called plutonium. It's right next to mercury on the plutonium. I'm not making this up. It's right next to plutonium, which is probably the most deadly metal. So if it's in the air, it's in the fish, if it's in the water, not good.
Dial soap, I heard. I just heard that
Oh,
last week. It's in the dial.
don't tell me that stuff. So anyway, when I was a kid, this is what they did. And if you were older, you probably got these in. They still do them, but not too much anymore. But I got this camera where I could take pictures of my own teeth. This is my tooth. And I could see not only that I had mercury fillings, but they were cracked. So I got rid of them. And the American Dental Association, you know, they're sort of waffling on this, although when you take it out of someone's mouth, you have to be very particular about how you take it out, but it's okay if it's in 2 inches from your brain. That makes a lot of sense. Or the EBA will fine you $100,000 if you dump it in your backyard, these old fillings. But it's okay near your brain. I don't know. I don't get it. Doesn't make a lot of sense to me. All I know is, see this guy standing right here? Haven't done one since 1969. You are not going to find anybody in Pittsburgh, because I taught half the city at the dental school, who hasn't done one since 1969. I mean, I've been always in that position. And I want to show you what an overhanging amalgam margin looks like. It's tarnished and corroded. You can't see this, but when I drilled out, that was underneath someone's gum line, tarnished and corroded. When it's tarnished and corroded, what does it collect? Germs. Germs collect around that. So that's the problem with these. So even if it's not toxic, it collects germs. So that's not a good thing. So we can take one out. You can see this is decaying. Right here, this is decaying. And put a nice white one in. Now, this mercury leak, people say, oh, it doesn't leak. No problem. It's in there, it's tied up, and I can prove that it leaks. I'm going to show you I can prove it. Because this is what's called a night guard. This person puts this night guard in because they grind their teeth. A lot of people grind their teeth from nerves and stuff, you know. They wear their teeth out. What do you think this is? This is the mercury filling leaking out into the night guard, right? I mean, what else could it be? There's nothing else it could be. I mean, all you got to do is use common sense, and you could say that black stuff has to be coming from the fillings that person's grinding away on. So when people say, oh, it doesn't leak, it's fine, I approve that that's not true. Now,
Does it take it out, though? Does it go through your body?
well, I don't think. I mean, we use high-speed evacuation. We suck it out, you know, and if you're real concerned, we put a rubber dam on, which is good. You can do that, but I think I'm pretty good at sucking it out with moisture and high-speed evacuation. And then we have you rinse out, you know. We're real careful about that. We do whatever the patient wants, but my attitude is I don't want to do anything that's going to hurt anybody, so I think I do it right in my office, but I listen to the patients. This is a material that I love. If you look right here in my mouth, you'll see I have it. It's called gold. Gold is called a precious metal, like platinum. They don't react to anything, and the body tolerates them. That's why the Egyptians, 5,000 years ago, used them on teeth and in their body, you know, in their ears and all over the place. So we like gold. Patients don't like gold sometimes for two reasons. One, if you're a female, you don't like the way it looks. And I don't like the way it looks either in the front of the mouth, but in the back, nobody sees it. And two, patients don't want to pay for it because it's more expensive. But there was a pastry shop near us in Oakland. It says cheap pastry isn't good, and good pastry isn't cheap. I like that because that applies to medical care as well. So I was talking to somebody about porcelain veneers, and I guess she's not here now. And she was telling me about porcelain veneers. So we can do that. Look, this is the color we started with. This is the color we finished with. That's the person. And we can whiten teeth. And if this is a picture of what happens when you're on methamphetamines and cocaine, crack cocaine, it ruins your teeth. You become a methyl mouth. And you can see this person got treatment and they got better, but then we had to fix them up. So this is the before, this is the after. You can see with bonding and so forth, we can fix this person up and they look just fine. Today, dentistry has come a long way. You won't realize that we use computers quite a bit. We can make crowns that are scanned and fabricated on that machine, which is a computer. And one of the things that we're also doing that's very exciting, in my office in particular, when you're missing a tooth, we put implants in. So in the old days, you had some kind of removable appliance, but with an implant, like a titanium tooth that's put in your jaw. The only problem with it, it takes 6 months or more, and it's a couple $1,000s to do. A lot of people don't have the money or the inclination to go all through that. So we can do other things that are less expensive, but it's really fabulous. There was a gal in yesterday, it's a friend of mine, and somehow she had a root canal that didn't work out in her front tooth right here. So it had to be removed, and we put an implant in that spot. And nobody will ever know. No one will ever know. It'll be just perfect. So implants are up in here, see? They're up in the jawbone, and there's a little metal part that sticks out. That's not what you see. Then the dentist will cover that up with porcelain, so it looks really nice. I hope nobody has a toothbrush like that. Get rid of it. We like electric toothbrushes. Now this woman has everything but what? Her teeth. This is Queen Isabella. She had diamonds, she had furs, she had feathers, she had any help. She had all kinds of people that helped her with her palace. But she didn't have her teeth, because if you look at her face, look at her mouth, her nose is too close to her chin. Right? That's what happens. And she looks kind of weird there. Now I'm going to go now into an area that I'm very excited about, because Dr. Weiner, Jamie, who lectured earlier, and I, and Daniel Engel, who moved away, we invented something because I'm an inventor, you heard that, but you need, necessity is the mother of invention. So in our office, Crest Pro Health, Procter & Gamble was giving us all this stuff real cheap, these chemical mouthwash. Then all of a sudden I decided, what the heck is in this stuff? Well, I'll just read. Phosphoric acid. Why would you want to rinse your mouth with phosphoric acid? Methyl and polyparaben. They're estrogen mimicking compounds. Women use that on their face sometimes, or all kinds of cosmetic stuff. Blue dye number 1. Why would anybody want a fake dye in their mouth? Sodium saccharin. It's been implicated in rats having cancer if you use too much saccharin. And I'm going to try to pronounce this. Cipapyridium chloride. And it says the replacement for alcohol. From the material safety data sheet, the substance is toxic to the lungs, mucous membranes. Repeated or prolonged exposure to the substance can produce target organ damage. There it is. It's the replacement for alcohol. Well, why would you want to replace alcohol? Well, alcohol like Listerine and Scope. Listerine, right here. 21% alcohol. And here's Scope, which is like 12% alcohol. And this is what I'm talking about. I want to read the back of the label. This is very popular, this stuff, but it says, warning. If accidentally swallowed, get medical help or contact the Poison Control Center right away. Right away. I'm not making this up. Here, look, she can see. That's what it says, right? So there is water and glycerin in there. That part's probably, but everything else is not that great. It's all chemicals, okay? So that's that. And here, this is scope, another one that you've all heard of. Alcohol, benzoic acid, sodium saccharide, blue dye number 1, blue dye. Same stuff about repeated and prolonged exposure can produce target organ damage. I mean, now you may say, well, I'm not drinking it, right? So let's say you have a heart condition and you take nitroglycerin. Where do you put it? Under your tongue. Why? Why would you put it under your tongue? It's absorbed. So anything you put in your mouth like this, guess what? It's getting in your body. And they just said, go to the Poison Control Center if this stuff gets in your body, right? Nice. What did Ben Franklin say? Common sense isn't that common. Listerine. Now, they got smart recently because they said, oh, people are catching on that the Australian Dental Society journal says that if you have alcohol, 21%, it raises your incidence of not getting it, but you could get cancer. So they're a little nervous, so they came out with natural, Listerine natural. But it still has 21%. This has 21% phosphoric acid, and this has all those other chemicals that I talked about. So it's not benzoic acid. It's not really natural. You know, saccharin, sodium lauryl sulfate. I know a lot of you shaking their head, no good. You know, benzoic acid dyes. This is the one that really intrigues me. So I have patients that have dry mouth. They have dry mouth because they're taking all these medications. And you know, saliva is important in your mouth because it washes away germs, so you need saliva. But if you have a dry mouth, it can really lead to a lot of problems because your mouth can't wash away the bacteria in your mouth. Biotin. This is specifically, it says, for dry mouth. But let's look at the second ingredient here. The first one's water. That one's okay, right? The second one is propylene glycol. Does any of you car mechanics know what they use that stuff for? Antifreeze. Propylene glycol. I'm not making this up, am I? You know? What the heck is it? Propylene glycol. And then there's also methylparaben and polyparaben, which we already discussed, or estrogen. So this stuff, talk about poison. I mean, don't swallow this stuff, for sure. But again, don't even use it. We finally got to something that, of course, I'm biased. I invented this with Dr. Weiner. Something that I can recommend. And I recommended it because I had nothing else to recommend, actually, to my patients, because I really believe you should use an electric toothbrush, you should use dental floss, and then you should rinse your mouth out to give your mouth a chance to be healthy all your life. And it's called Miracle Mouthwash. I even like the name. You know, you guys on sales, that Miracle soap over there. I think that's a kind of neat name. But it's with all natural ingredients. There's nothing in this material, in this bottle, that will hurt you. And the main thing, if you have a refrigerator that smells, what do you put in it?
Baking soda.
Yeah, baking soda. So the main active ingredient, I would say, is baking soda. Baking soda is really good because remember we talked about acid is what dissolves your teeth. So you want something to neutralize the acids in your mouth. So baking soda, alkaline as opposed to acids. So that was the main thing because personally I use a lot of times baking soda toothpaste. I like it. I like baking soda toothpaste. So that was the main thing. But then I'm big on xylitol. I talked to you about xylitol because it's a sweetener, makes things taste good, but it's an alcohol sweetener. So that's in there. But then we wanted something safe that all of you in this room know about that are called essential oils that kill viruses, fungus, and bacteria. I don't know about parasites, but we don't have to worry in the mouth. They don't get in the mouth, parasites. So anyway, they are cloves, wintergreen, spearmint, and peppermint. Now, do any of those sound dangerous to you? Not a one. they're all safe. They're all safe, every one. So that's 6 ingredients. There's 4 more to go. Then, I told you, under your tongue, things are absorbed. Echinacea would be a good thing, right? Yeah, makes you feel good. Good for your brain. Put that in there. And then thyme and cinnamon, also good. Safe, right? No problem. There's one we put in that you don't know about. The oldest man in the world, he was a Chinese guy. He lived to be 118, finally died. He says, the reason I live so long is I have this herb that I chew on or eat or whatever. It's called Gouda Cola. So we put that in there too. And that's it. There's not one thing in all the ingredients there, as opposed to what I've been showing you with the competition, that will harm you. Not only that, you don't have to be a rocket scientist or a scientist to understand what methyl and polyparaben is, or polymer 407, which is plastic. That's in this, polymer 407, palmoxymer, I'm sorry. I mean, who wants to be swishing their mouth out with plastic? Okay, so this is what my office looks like in the spring. We're very patriotic. See the flag? This is one of my dental patients that we did an implant on recently, and I'm proud. In 2014, I'm still top dentist award, and I think that's it. So, who has a question? Anybody with teeth can ask a question here.
We have several questions, sir.
Yes.
Okay. The first one was her question. She wanted to know what discoloration of the gums signify and how it can be healed.
Discoloration of the gums meaning redness?
Yeah, or redness, brownness, when your gums are anything other than pink.
Okay. So when your gums, it's mainly redness. This is the biggest problem. Have you ever brushed your teeth and they bleed? Okay. So why does your body put more blood cells, in particular white blood cells, around your gum line?
Is it inflammation?
Mm-hmm. Inflammation. But what causes inflammation in the gum line? Bacteria. Bacteria. That's very good. Bacteria settle on the gum line, so your body says, hey, I got to get rid of these. So I'll send in an army of white blood cells, neutrophils, all kinds of lymphocytes, phagocytes, giant cells, but they're all red, actually. I mean, under a microscope, if you look under a microscope, there's a white halo. That's why they call them white blood cells, but they're red, like that. So when you get bleeding in your mouth, something's wrong. You need to come to Dr. Werrin and get your teeth cleaned because you probably have a lot of germs on your gum line. And that's why they're bleeding. Your body's saying, I got to get rid of all this stuff, so I'll send an army of white blood cells and try to kill all those germs. So that's usually why you have a problem. That redness is the main, it should be salmon pink. If you look at your gum tissue, they should be salmon pink in color. Yes?
I just have to tell you this. I went to my hygienist.
Hygienist. Yeah.
And she said my gums were in the best condition they've ever been in, and all I've been using since I came here is Pilu toothpaste.
Okay, but I just want to tell you about toothpaste. It's not the toothpaste. It's the toothbrush. See,
No, but Pilu toothpaste is so, I have sores in my mouth that I've had for 9 months and nobody can figure
but I'm going to tell you what I think since I'm the dentist. When you use Pilu toothpaste, because it's real expensive, that stuff, you're paying particular attention to really use it well, and you're getting the germs off your gum line. And the germs are usually what cause the problem. Now, you're assuming that Pilu toothpaste kills all the germs, but what really kills them is mechanical elimination. If you had a dirty floor, you could use 15 different soaps on the floor, and it wouldn't matter as long as you really scrubbed it good. So I personally think that's why your mouth's looking so good.
No, I have sores all over my mouth. And
I know,
I've been
but
to 11 doctors, and none of them know what. I've been to the infectious disease doctor, who's supposed to be the best doctor in Pittsburgh. He sent me to the best dermatologist. I've had.
I want you to try Miracle Mouthwash and stop
I'm gonna buy it.
stop with the Pilu and then report back to Dr. Weiner and I and tell me if it helps, because baking soda is also a very good
Just
cleaner.
makes your mouth I mean, it's the only thing that soothes
Yeah,
my mouth.
I have never used it. I don't know anything
It's so
about it.
soothing. It
Yeah, Everybody should use a electric toothbrush. There's only two kinds that are made that are really good. One is called Oral-B Braun, and the other was Sonicare. Unfortunately, for the average American, it costs over $100 to get these brushes. At Walmart, you can get the cheaper version for like $55, maybe. But if you use just a hand brush, a regular toothbrush like you did when you were a kid, it doesn't work as well. That's not to say that you can't make your mouth healthy that way. It's just harder. And you don't have to worry with an electric brush because you just move it all around. With a regular brush, you got to really pay attention, and it's just harder to do. That's all. Sonicare or Oral-B Braun? Oral-B.
Oral-B Braun?
Yeah. Braun is the name of it's a German company, but Procter & Gamble, I think, has it. Oral-B Braun. Oral-B. Yes, dear. Here.
I had done some reading, and it was basically centered around cavities being a nutritional issue based on the balance of, I guess acid or whatnot in the mouth. I wanted to know if it's actually possible for cavities to be healed through nutrition.
It's not easy, but yes. Well, yes and no. If you have a very small cavity and all of a sudden you get religion and you stop with the sugar, which produces the acid, they will just stop. And on top of that, there's ACP in certain toothpaste, ACP, like baking soda, ACP, amorphous calcium phosphate. And that amorphous means it's any old shape, and it will get into the cavity. When a cavity is very beginning-like, it's white, and then it turns brown, and then it turns into a cavitation or a hole. So if you get it in the first two stages, you can, and you keep the lactic acid off the tooth, it will heal itself. Like Dr. Weiner was saying, your body will heal itself if you give it a chance. But most people who got the cavity in the first place are eating too many corn puffs, or cocoa puffs or whatever, with candy and stuff. Yes, dear.
Did you also say when you get your teeth cleaned, you're not supposed to get them polished?
No, I didn't say that.
Oh, Dr. Weiner said that.
Yeah, but he's not a dentist. Don't.
But he talks
Is he here? No.
He talks
Don't
about
listen to him about teeth.
about how wonderful you are, so I thought he got it from you.
He has a lot of ideas about dentistry that I don't agree with. But I've treated a lot more teeth than he has.
Okay, so
He's treated a lot more joints than I have, So stick with him with the joints and stick with me with the teeth. That's my attitude.
Get them polished?
Yeah. Well, let's talk about why. Why is that important?
He told me it right.
And every time a germ gets on your tooth, if it's on a corroded old mercury filling, it says, hey, this is a good place to make babies, and I'll poop all over this corroded place. But if you have a high shined area, the germ says, hey, I can't stay here. It's too slippery. I'm falling off the tooth here. See? So that's why you want them polished. You want your teeth as smooth.
Everything you hear from him.
No, a lot, but not teeth. Stay away from the teeth part. We argue a lot about, I won't even go into what,
okay.
about stuff. Let's put it this way. My teeth are better than his. All right.
Are you accepting new patients?
Oh, yes. I depend on new patients. Yeah, I love new patients. This is the problem I have. I have a lot of patients that were 30-year-old patients, 25, 20, even older than, I won't say how long, but I got them in good shape. All they do is come in twice a year and get their teeth cleaned. I'm sort of that way, actually. I don't get too much done anymore. If you're doing the right thing, prevention is worth a pound of cure. An ounce of prevention is worth a pound of cure. People this age, by the way, because they had fluoride in their water, even though they didn't ask for it, they got it. Do you have a lot of cavities? No. Do you have a lot of cavities? No. See, our generation, I'm older than you, we didn't have fluoride in the water. So the teeth became very susceptible to lactic acid from germs. Plus, tasty cakes were so good when we were a kid.
Oh, tell me.
So dental floss when I was a kid was not invented. Can you believe this? How do you clean your teeth without dental floss? How do you get between your teeth? That's where most of the problems are. And when I was a kid, nobody used dental floss. Yeah, well, it was there, but nobody used it. I mean, like 0.5% of the population used it.
I first went to the dentist, I had 21 cavities.
Yeah. But I'm telling you, it's a problem you have. It's your diet. It was your
I
diet.
was a kid.
I know it was a problem when you were a kid. When you're a kid, someone goes into the bank with a kid, and on the top of the bank, there's a big thing there. Lollipops. Oh, have a cookie or a lollipop. What do people know? You know, it drives me crazy when I see Christmas time, there was a thing on Facebook. We're poisoning our kids with all this candy, you know? We really are. But, you know, what are you going to do? It's an uphill battle.
What are you recommending for dry mouth?
Well, Miracle Mouthwash right here says, it says, a dry mouth is the #1 cause of bad breath. So you can use this. That's one thing. What I recommend is try to get off the medications you're on. You're on medications.
Oh, it's not me.
Okay, well, this person you're talking about, this person is on medications. Try to lower those, because that's what's doing it.
Did you tell Dr. Weiner how to floss your teeth, or is that his? Somebody he talks about how he just learned to floss his teeth. He was
Really?
doing it the wrong
Well, we have a dental hygienist who happens to be his neighbor out in Highland Park, you know, so he'll listen to her a little bit more than me, and
He
hopefully.
said he thought it was just to get particles out, which is what I thought.
No.
And now he
You gotta get the
would you
plaque
tell
off.
the proper way?
Yeah, you have to. Actually, I don't care what you do. There's this film called plaque that's on your teeth, and you weren't here when I brought a microscope in here, and I had people volunteer, and I actually showed them the plaque that was on their teeth on the microscope, which is germs jumping all around. You girls would find this very fascinating. It sort of spoils kissing to some extent. But anyway, all I care about is that you get the germs off. I don't care how you do it, but if you think about it, if you put the dental floss through, go back and forth like a shoe shine letter C, and then a backwards letter C, and then pull the dental floss out.
That's what I did. He said
Yeah.
you have to go around in 3 corners and push it up.
I don't know what he's talking about. All I know is get the plaque off. I don't care how you do it. If it's not there, you'll have no dental problems. And like these girls said, you'll also have no redness and bleeding, because that's what causes most of the problems. Okay, I think if there's one more question. Yes, last question.
What can you tell us about oil pulling, and is it effective?
Oh, I'm glad you said that. See, a lot of you don't watch viral videos on the internet like she does.
I do.
Yeah, see? and she does too. She watches that stuff. But oil pulling is something that had a great video with some guy in California, some beatnik kind of guy, put this wonderful video on about oil pulling. So here's the deal with oil pulling. All you got to do is put this coconut oil in your mouth for a half an hour and sit there for a half an hour.
Now you got swish.
And switch it around for a half an hour. Now, how many people, by the way, and it doesn't taste that great, but this is not a technique that's going to last very long, because nobody has a half an hour to sit there and do this about your teeth, when in 2 to 3 minutes you can get all the germs off your teeth. It doesn't make any sense. I don't know if it works or doesn't work, but it's stupid in my mind, because nobody's going to do it after they do it 1 or 2 or 3 times. Or if you are doing it, get a life, will you? I mean,
It doesn't have to be for 30 minutes.
that's what the guy recommends.
But that's him. But you don't have to do it for 30 minutes.
Well,
If
it's
you're-
him, because if you don't do it long enough, I mean, what are you trying to do there? Kill germs, right? That's the whole point of this thing. You can kill germs. It's like if I had a flea right here. I could take a fly swatter and go, bam, kill the fly. Or I could get this 25-pound hammer, and I could go, bam. It's like killing a flea with a sledgehammer. Yeah, it might work, but it's stupid. It's too much energy. It tastes bad. And you got better use of your time than sitting there with oil in your mouth for even for 10, 20 minutes. I mean, 2 minutes is fine. I can't get some patients to brush their teeth twice a day, let alone, But But if you like what the guy says, do it. It won't hurt you. I don't think it'll hurt you, but I don't think it's of any value. And you have to spend money on all that coconut oil.
My daughter gives it to her dogs. They're bad.
Really? By the way, your daughter's dog has bad breath because my father was a veterinarian. Because they feed them people food. So if you feed people food, what's people food? It's convenience food. What's convenience food? Sugar. Sugar breeds bacteria. Bacteria knocks out their teeth, and when their dog gets old, they got to get teeth pulled. So tell her just meat.
Well, she don't feed it. Once you come to her house, like me.
You feed it. All right. All right, that's it, everybody. Thank you very much. I hope you all learned something this afternoon.